Welcome to the Pacific Southwest, MHTTC's new program, Rising Practices and Policies in Our Workforce. As I mentioned earlier, my name is Angela Castellanos, and I'm a school mental health TA specialist for the Pacific Southwest. And I'm going to be moderating this session today. We are so grateful to be funded by SAMHSA and also want to be clear that the views and opinions expressed by our panel speakers are theirs only. And this particular session is really close to me as a former coordinator of mental health and school social worker. I worked as a school social worker, but also as a homeless liaison and foster care liaison. And I know the firsthand resources and supports that are needed for students. So I'm super excited about being in conversation with you today and also with our panelists. Today, we're going to be offering a brief introduction of our series and overview of what brings us here today. And we're going to get to hear from incredible regional leaders about rising practices and policies that bring us hope and caution. And our series supports the school and broader mental health workforce, and we invite you to translate or transfer their sharings to your own context as well. This is the third session of a 4-part series, and our team has designed 4 sessions that reflect rising issues impacting our mental health and school mental health workforce. So this is the conversation that we're going to be entering today. I want you to kind of think about and take a look at our definition of home insecurity and homelessness. What comes up that surprises you or reminds you as you're reading this particular slide? We're also going to have a conversation about home insecurity and homelessness as a social crisis, and it could be much broader than stigma and stereotype of living on the street. We also know that housing problems can often co-occur with gaps in our mental health care systems and social services systems, and not to mention the housing market as well. But because our region serves the Pacific Islands, Hawaii, Nevada, Arizona, and California, this topic is pertinent and fundamental to our skills as school and mental health providers. Let's bring in our region's incredible leaders to expand this conversation. They may not be offering solutions to the affordable housing industry, but they will offer ideas and suggestions for how we can best support those who have been impacted by the industry to live with more dignity and less pain. Our panel is rich with expertise from a diversity of different roles and perspectives and experiences. We have Talarita, Arash, Dana, and Claudia. Welcome. Thank you so much for being here today. Each of our speakers will share their responses to our guiding questions, and then we will have, again, an opportunity for Q&A.
Hi, good afternoon, everybody. Talarita Tuni Rogers I am participating from Denver. I have recently been appointed the executive director with the Denver Indian Family Resource Center. However, since this is the Pacific Southwest region, I will be referring to my previous work experiences in that region, which is primarily in Arizona, in Flagstaff, Arizona, and for a short time in the Phoenix area. Also, while working for Native American nonprofit organizations supporting the community. So I wanted to start off with a review of some of the terminology that you might hear today and you might have already heard, but also to talk about the importance of using terms that really promote the dignity of the person. And one of those terms is homeless. And so there is a formal definition and a popular way of using the term homeless. However, a more dignified way to describe somebody's experience as unsheltered or unhoused would be to describe that experience in a more descriptive way, which is that they don't have a shelter or a home that they can enjoy as many of us do. And so it also removes the stigma of the expectation of having that housing, because as you'll learn today, that housing can be reliant on a lot of different factors, many of which are out of our control. And so if we can describe the situation rather than the circumstances that people face, then It allows those individuals and people experiencing the situation to regain a little bit of control over that situation. So because of that, I do want to encourage the use of people experiencing homelessness versus the use of homeless person, because as you'll learn, it's a situation. For some, it's temporary. For some, it can be a long-term or a chronic type of situation. But we always want to talk about people in a way that describes who they are as a person versus what their situation is. And so that would mean talking about people experiencing homelessness who have those experiences rather than calling homeless people. So reframing that. I also just wanted to kind of go over the population that we're going to be talking about today, which comes from the federal definition of youth who are experiencing homelessness. And that term is unaccompanied youth. And you'll likely hear that term throughout today's presentation, since that's the population we're talking about. I mentioned chronic homelessness. There is a definition from HUD that really highlights this, and that is oftentimes you'll hear just in conversation with individuals who have a short, unstable housing situation, describe that experience as homeless. And while structurally true and while descriptive, the HUD's Housing and Urban Development's formal definition of chronic homelessness means that a person has been consistently homeless for 1 year or intermittently 3 times over 5 years. And that's important because that definition really leaks into who is eligible for services and who is eligible for funding opportunities that can help them to regain either shelter or stable housing. And that's really, really important when we're talking about unaccompanied youth and individuals who also experience other needs, such as mental illness and other life experiences. And so when we focus on the population of youth between the age of 18 to 24, we also have to really consider what developmental stage that they're in, because a big part of their journey and either chronic or leaving the unsheltered status really depends on their ability to gain the skills to be a strong communicator, to be a strong problem solver, as well as a strong decision maker. And I'm realizing I left one important piece off of this list, which is that they also need to be able to reach out to their support people. And so since we're talking about youth, that often can mean educators and those who have that connection with them when they're away from their family. So if you think about where a youth between 18 and 24 years old are, they're still developing in terms of their brain development, in assessing risk and in assessing how to communicate with adults and with their peers. And so when you are supporting youth, it's important to keep that in mind about where the youth is along that stage of development. So because of these vulnerabilities, youth are especially at risk for violence. They're at risk for the trauma that comes out of that violence to develop or to exacerbate any mental illness they might have. They're also especially vulnerable to trafficking because they can, their developmental stages can often, I don't want to say support, but it is a way that youth can lower their guard and lower their inhibitions in evaluating people who are at risk to put them into the trafficking pipeline. And so all of these vulnerabilities really put youth at risk for all of these areas of violence, mental illness, for trafficking. They're also at higher risk for not completing high school or earning a GED, especially when they aren't utilizing those natural supports that youth who are very active and involved in school are. And as I mentioned, they're also at risk for entering chronic homelessness. And so being able to have conversations like this panel today is really important for the community to really come together and talk about how and implement ways to to support our youth. And I want to talk briefly about one youth that I was fortunate to provide support to in a previous role in Arizona. And this situation just really highlights that risk for violence, that risk for trafficking, and that risk for not completing high school. This youth, I believe he was about 16 or 17 years old. We became aware of him because a member of the high school support team reached out to my organization asking for a sleeping bag and motel assistance. And what the story eventually that was shared with us is that this youth had tried to use the shelters in the city that we were located in. And unfortunately, because he was a young male, he was essentially highlighted to those in the shelter and was targeted for verbal violence, and there were threats made against him, and especially because he had a very nice sleeping bag, he was also targeted for being able to access the resources that he was able to. So it turns out that he eventually asked his school support team to help support him in connecting for motel assistance, and that way he could reduce that risk for violence and all of the other risk factors that come in. So I think that experience just really highlights how important it is that school support teams and adults are able to help support youth. Just to really highlight again some of the ways that we can support and help youth in preventing that pipeline to violence and trafficking and chronic homelessness is to really support supportive relationships. And when we're talking about youth, it doesn't have to be adults, it doesn't have to be teachers, but because youth are more likely to be at school, that often brings in your roles as educators to that supportive relationship. However, we also have to remember that their peers are also supportive relationships in supporting youth to help one another and to communicate with one another to access resources is an important prevention strategy. It also is really helpful to teach youth to develop communication skills and to practice those communication skills. And so you can do this even in a math class or in you can highlight this if individuals are on an athletic team, just developing the importance of those communication skills. And then for those youth who are in an unstable housing situation, it's ensuring that they have access to distance courses with support so that they can continue their education and complete that. Supporting re-engaging family, and I'm not talking about re-engaging or forcing abusive relationships or situations that require child welfare involvement. I'm talking about supporting the communication skills that youth and families need so that they can remain together. And then for youth, it would also be helpful to educators to volunteer for the point in time count. And that way there's a familiar face. I don't have time right now to go over the point in time count, but we can share resources for you so that you know how to access that. And then finally, HUD a few years ago discontinued funding that supported youth needs. And so if you have an opportunity to participate in a call for to advocate for funding from HUD, I would recommend that you ask HUD to reinstate funding to support youth needs.
Thank you so much, Talarita, for grounding us and setting us up with terms. And also the piece that I also took with me is the importance about understanding the developmental stage of youth and how that is very crucial for us to get the supports available for the students. And so now we're gonna hear from Arash.
Thank you all for having me. My name is Arash Ghafouri. I'm the CEO of Nevada Partnership for Homeless Youth here in Las Vegas, Nevada. So my organization serves young people experiencing homelessness from the age of 12 through 24 here in Las Vegas and our surrounding communities in Southern Nevada. I want to first thank our host and all my amazing and esteemed co-panelists. And Talarita, I want to thank you. It's perfect that you kind of let us off and kind of talking about really just understanding the nuances that young people in these situations are experiencing, including their, their development and other factors that impact their experience and that we that interact with them see sometimes. So better understanding those things is really the whole point of what I want to talk about. So at Nevada Partnership for Homeless Youth, really quickly, we serve, again, young people experiencing homelessness from the age of 12 through 24, yet we focus a lot on unaccompanied minors experiencing homelessness. So those would be minors, under the age of 18, obviously, that are experiencing homelessness and disconnected from parents or legal guardians. So they're an especially vulnerable population as they're on their own with their experience. And, really quickly, I'll just add that young people experiencing homelessness is different than any other form of homelessness because one, it happens to them suddenly and unpredictably the grand majority of the time through no fault of their own. And two, it happens during the most critical and formative education years. So unfortunately, they're kind of in a situation where they have blinders on to the world around them, what resources are available and how to help themselves. But I don't think that they're the only ones that are in that situation because we, ourselves as those that are working with them, whether it's in a community-based setting or a school setting, also need to reduce the amount of blinders that we have in terms of understanding what they're experiencing, how that experience can manifest itself in school settings and what we can do about it. And that's really something that's important and something that I hope to get across in my time. So again, thank you so much for that. We work really closely with our local school system and both K through 12 and higher education. So a lot of this applies both ways, but we work really closely with our Title I and McKinney-Vento liaisons in the school district's offices and throughout the schools themselves to really work on training and other strategies to try to make that difference on the ground, which I'll go over starting now. So unfortunately, sometimes the stigmatization that's happening within the schools comes from a lack of awareness among teachers and school staff and others on the ground. And this is an inadvertent, of course, stigmatization. It's not intentional, but a lot of it is that we don't understand how that a young person is experiencing homelessness. Often they haven't been identified. And we don't understand sometimes how this can actually impact them in the classroom, both academically and socially. We work hard, but we must do a better job of making sure that it is a commonplace knowledge among schools and among all levels of personnel within those schools that what is a young person experiencing homelessness, how can this show up in classrooms and other school settings, and what are appropriate interventions and strategies. This should be a commonplace among all staff right now. I dare say I can't speak for the whole country, but at least in my community, it's only a handful of people sometimes within each schools, if that are aware at the level that we need for them to truly impact the young person experiencing homelessness in a positive way. So one way to immediately do that is to change that and work on creating that more common knowledge throughout the school. Youth homelessness is a 24/7 problem. When the school bell rings, their issues with school does not end. And oftentimes we work with teachers a lot to remind them that the problems that they're experiencing from outside school are impacting them in school. And we aren't recognizing that sometimes in a sufficient way, and we can do more to improve that sort of that gap around that recognition. This is really going to help us stop misidentifying and mislabeling young people. For example, they often exhibit behavior that is often a symptom of their challenges that they're experiencing with homelessness. But often this can be misdiagnosed, mislabeled them as just, being a behavior child or a trouble child, when in fact, it's often just a case that they're exhibiting symptoms of their experience. And this could be everything from, not being focused in a classroom, seeming distracted or not caring about their academic success, legitimate reasons why they would be late or absent from school, or wanting to avoid certain classes or even certain parts of the school. Too often we see young people getting suspended or expelled from the very one place that is often their last place of refuge, which is school setting, where they can count on a free meal and some safety from whatever instability they're experiencing in their life during those school hours. So we want to make sure that we remove some of these stereotypes and some of these stigmatizations that they're experiencing, because oftentimes a young person for example, may not be invested in their academic success for a reason as simple as or someone may think that they're not investing in academic success because it could be a simple reason that they don't have a place to actually study at home, that they have a technology barrier to access to do their homework, or that they don't have sufficient access to hygiene or other resources to feel comfortable coming to school and not getting bullied by their peers. So there's a lot of ways that we want to work on educating the reality of the situations. And sometimes these young people will not ask for help because they're embarrassed, they're fearful, or they lack the awareness of their own experience sometimes. So if we do more of this, improve that education, create that more common ground, teachers can create better atmospheres within their classrooms, and schools can more appropriately intervene and create safe environments for these young people. That would be more class time to do work. That would be, identifying and stopping bullying that occurs because of clothing situations or hygiene situations. So we at NPHY, we operate something called the Safe Place Program. And we find this as a really non-stigmatizing way to go into classrooms, to go into school settings like a cafeteria during lunchtime or other break times, and talk to young people, talk to teachers, and talk to other student personnel in a very non-stigmatizing, non-identifying way where we just talk about youth safety. The word homelessness isn't in the title. We introduce ourselves as a safe place program. And all of this is very intentional in a way to make sure that, one, we make all youth aware of the plight of other youth may be experiencing. Two, we signal subtly to those that may be experiencing homelessness or insecurity that we're there to help. And three, we're educating the adults that are closest around them on what they can do and how they can identify and how they can and how they can be part of the intervention and solution. So this allows working with teachers and focusing that common education knowledge around all school personnel will really start helping us kind of reformulate how we approach young people in our classrooms and in other school settings. So community-based organizations can really help increase awareness and provide intervention strategies and options for educators. This happens by creating regular and recurring trainings on a variety of topics related to youth homelessness. For example, if we could get, a whole hour, Telrita, in the beginning to talk about all the different ways young people are experiencing homelessness and why, and how that impacts them, and how you may see that in a shelter or in a class. Those things are fundamental to improving our ability to help young people. So it has to dive into details of what it is, how we identify it, what type of youth are disproportionately impacted by homelessness. There's youth in some way, youth experiencing homelessness in some ways transcend socioeconomic factors, but in other ways, it is disproportionately impacting youth of color, BIPOC youth, LGBTQ youth, Native youth, and other types of youth as well. And understanding that and knowing what appropriate intervention strategies are within those subtypes of young people is incredibly important. also, it's not just about identifying and knowing that it exists, but it's about what a teacher can do in their classroom, what a mental health professional can do in that situation to identify and foster a safe environment, and even going as far as to starting to think about how to resolve peer-to-peer conflict and creating better peer-to-peer environments as well. This is paramount because teachers are often, I would say, frontline responders in school settings for youth experiencing homelessness specifically. They're going to be the ones that are most often in a position to and identify a young person experiencing homelessness and begin those intervention strategies, connecting those dots to them, getting them to that next level. Yet, the trainings aren't enough by themselves, as schools, teachers, and youth experiencing homelessness need solutions. And not only do they just need solutions, they need solutions, and this is my critical point, that are actually accessible to both the adults that are identifying and the young people that are experiencing it. And it just can't be a simple referral. So we must be really innovative to go beyond just that referral. So it's great that, sometimes in a school setting, we can provide that referral to community-based organization. However, we want to make sure that we go a step beyond and try to bring those services to where the youth are. Youth have transportation barriers. Youth may have after-school barriers where they can't possibly access services. They may have safety concerns or abuse concerns where they can't safely go to a drop-in center or another environment. So what we need to do is make sure that we go beyond just making young people aware that places like NPHY, RISE, or other places exist, but rather how can we bring our services to them and meet them where the need is. So we ourselves already are working on, for example, providing recurring training at the school and administrative level. And this literally means at every school. And we are even at the level now that we are under database for internal trainings that teachers can access in an ad hoc way. However, this is what we're doing now, and we'd like to take it a further step and not make it something that happened because we are advocating at the administrative and school level to get in there, but to actually have it be a mandatory part where the school and the district has a unified and on paper response to youth homelessness and what they're doing about it and how they're doing what they're doing about it. Because this is what we need to get into. It's the devil's in the details around what the intervention strategies and exactly how we connect the dots for young people is the battle and is what we need to work on improving. So we specifically also are already doing in-depth trainings with Title I advocates, counselors, and those that are actually assigned to address the homelessness situation at the school level. So we provide not just basic kind of youth homelessness 101 training, but more in-depth training on identification, intervention strategies, et cetera. But now using ARPA money and some other, McKinney-Vento resources, we've worked out a deal with the school districts where we're now actually hiring case managers, and they're going to be deployed to high need schools to not only work on identification and intervention, but to actually begin intakes and other assessments right there on the ground. So a young person doesn't have to wait for a referral, doesn't have to wait for figure out a way to get connected with our organization, but that it can actually happen right now. And the flip side of that is if a mental health professional, school nurse, teacher needs help, needs help with triaging a response or what to do, that help can be immediately provided and accessible because our staff are going to be there on the ground. Two, we're going to use that as a foundation to start exploring the idea of having mobile drop-in centers. That would be retrofitting kind of, RVs that we can use. Three, RVs that we can use to create drop-in centers with those staff. We can create a safe environment so young people can go get school clothing, have a safe place to do studying or get tutored after school, et cetera, if they can't make it to our drop-in center, to school's closing. Eventually, we hope that goes into a one-stop triage hotline for school personnel staff, where they can call and have one number to get that support right there immediately. And then, of course, making our training more accessible, more digital, and ideally data sharing would be really important. I like to say that it's like we are half the doctor and we have half the medical notes, and sometimes school or other personnel or the other doctor, they have their own medical notes, but because we don't have the right agreement, we can't actually share the entire patient chart so we can effectively, help and empower these young people that we're seeing sometimes. So I'd love to see more of that. So I want to be respectful of others' time, so I'll end there. But you'll see on this slide, there's even some other ideas like creating guiding principles. But I just want to thank everyone, and I hope during Q&A, if I confuse anyone or can help clarify anything, I'll be happy to do so. Thank you.
Hashtag go beyond the training, hashtag go beyond the referral. Now we're going to hear from Dana.
My name is Dana Lucio. My background is in clinical mental health counseling. I am also a certified anger management counselor and a certified substance abuse counselor. I work at RISE, which is Residential Youth Services and Empowerment, and I am the Behavioral Health Program Manager. And I also oversee practicums as a clinical supervisor and the program manager for the education and employment supervision. We are in Hawaii. We are working to expand to outer islands. However, we are currently on Oahu, and we have several locations throughout Oahu. Today, my focus is more so on kind of addressing some of the ways we have faced some of those stigmatisms and the challenges and barriers that youth experiencing homelessness have undergone. So who are we? RISE, we provide 24-hour shelter services in Kailua, Hawaii, and we are able to house individuals who are experiencing houselessness, and they are able to stay here safely under professional supervision. And with that, our services include receiving skilled medical attention. We partner with an agency called Healthy Babies, Healthy Mothers. And what they do is they come to our site multiple times throughout the week to provide medical services, acute care, as well as like if a woman is experiencing any type of challenges with breastfeeding, they are able to help them with that. They help them with any prenatal care, postnatal care, any type of birth control administration and such. So we are very honored and lucky to have them a part of our team. With that, we do receive nutritious meals for the clients, and a lot of that comes from like donations as well as other food banks and such throughout the island, especially with COVID taking place. We've been honored to receive a lot of those nutritious meals for the clients. We do have like a drop-in service where clients are able to come, say that all of our beds are filled and we are unable to house them at nighttime. At least they can come for 12 hours within every single day of the week to clean their clothes, get a hot meal, watch TV, play games, participate in individual and group counseling sessions. And with that, they can take showers, receive counseling, and I'll go a little bit further into the different programs that we have that supports youth that are experiencing homelessness. Some of that includes job training as well as employment assistance. And one way that we help with some of the challenges with education is we offer incentive programs for educational progression, like GED education or paid internships, as well as helping them to get linked up to educational goals through college and such. With that, we do serve individuals ages ranging from 14 to 24 years. Our vision at RISE is a community where there are no youth homelessness. And with like calculations throughout the island, I'm not sure if many of you know, but at minimal, there's about 300 per year that are homeless. And our goal is we are able to serve 150 of those per year based on our previous years. We've been open for 4 years. And the goal is to basically work ourselves out of a job. Our mission is to provide a continuum of support to the client that empowers Hawaii street youth to move beyond homelessness. And whenever they are out of our age range, our goal is also to help them to maintain that stability so that they don't fall back into those vulnerabilities or be exposed to any traumatic events. I was hearing other panelists discuss, some of the challenges with homelessness, and a lot of times just homelessness alone it leads them to having traumatic experiences, and our goal is to prevent that. And with that, we do use like a very much trauma-informed approach for the clients to hopefully address any of those barriers that they are experiencing, or at least minimize them. So at Rise, we do have multiple programs. The first one being our shelter, which I have discussed. And with our shelter, we're able to bring in, we are able to have 10 males and 10 females, and we do support the LGBTQ population, as well as like if a male is transitioned to female, we allow them to choose which gender they want to identify with, and they can live within whatever space they identify with. In our shelter, like I said, we do have many staff members on site to include our shelter staff. We have YCCs, which are youth care coordinators, and they help with just making sure the facility and everyone around us is safe at all times. And then we have our outreach team. Those are essentially the individuals who go against everybody's vision or the stigmatism that youth homelessness or dangerous individuals. They go against that, and they go out to the streets, and they build relationships with the clients, and they develop these therapeutic alliances, and they gain the trust from the clients, and they bring them into our facility, and that's what keeps our beds filled. So our outreach is really the backbone of our agency, where they keep our shelter filled so that we can hopefully end youth homelessness. And then behavioral health, as I shared, I am the behavioral health program manager at Rise. And with that, we offer several counseling services where we are able to do individual counseling, marriage and family counseling. We can also do substance abuse treatment and certified anger management counseling. And that's where if a client has, for whatever reason, been in trouble with the judicial system and they're mandated to participate in anger management, we are able to help them to fulfill those requirements, so that way they can hopefully come off of probation. And the goal would be like a very much cognitive behavioral approach where we can make lifelong changes for them. And next, with that, we also do travel throughout the island to our other sites to provide the same services outside of the shelter and in our other houses and such. With that, we do have housing located throughout the island, where we are able to house approximately 50 additional individuals who were previously experiencing homelessness, and we're able to get them vouchers that allow them to have subsidized housing. We have a team of case managers who help with obtaining necessary vital documentation that allows them to get these vouchers that are necessary for housing placement. And they're also able to help them to get items that are needed within their homes once they do move from the shelter into their homes, so that we're not setting them up without like a bed or something like that. We help them with the full transition. In addition to that, we do have our education and employment team, and that's a team full of counselors who meet with the clients, and they help them to identify any of their education goals or employment goals. They help with resume building as well as interview preparation. We have some incentive programs where if the clients do participate by going to school, say they're finishing up their last 2 years of high school, we will pay them $100 a week to participate in that and just to go, as well as our GED program where the clients are able to go to school at our location, and they're able to obtain their GED with an incentive to continuously participate with their educational progression. And in addition, we have another program called 4 for 40, and that's where we will have the clients work on the farms or other locations connecting with the land, the Aina here in Hawaii, and they are able to get paid for participating in those kind of activities. So if they don't have any form of income or a job at that time, they will at least have something to sustain them while they are trying to end their homelessness.
Thank you so much, Dana. Lots of resources. One of the things that I wrote down is move beyond homelessness, right? And now we're gonna hear from Claudia.
My name is Claudia de Larios Moran. I'm the principal of Buena Vista Horace Mann K-8 Community School. We're located in the Mission District of San Francisco, and we're K-8, which means we get these kids right after they leave preschool and we keep them all the way until they're ready to go to high school. And my own students went through Buena Vista Horace Mann, so I got to experience what it means to really have your child in one educational setting for the bulk of their childhood years. I got to experience that as a family member, and know what it means to grow up through the grades with a group of children in a group of adults that you can really settle into a community with, that you really get to know very well. So I'm going to tell you a little bit about a project that we launched at our school. And I really do think that it's not a coincidence that it happened in a place like Buena Vista Horace Mann, that is not only K-8, so you have this luxurious amount of time to develop a sense of community with the participants that are there, but it's also, and very importantly, a community school. So I'll tell you what it means to be a community school, how that's a little bit distinct from just being a regular school. But I'd like to start our journey with the neighborhood that we're located in. This is a picture of our school's float in the annual Carnival parade. If you've been to the Mission District in San Francisco, you'll know that it's a very proudly Latinx neighborhood. We have a very strong tradition of celebrating cultures, especially cultures from all over the Americas. But it's also known as a neighborhood that has welcomed many waves of immigrants since, for at least the last 100 years. And then, of course, before that, this is unceded Ohlone land. And the Mission District is actually the origins of the city of San Francisco began. So you can feel that in the neighborhood itself. It is an absolutely vibrant melting pot of communities. And it's been hard, I would say, over the last 10 to 15 years because of gentrification. So we, it's been hard to maintain our character as a predominantly Latino, predominantly working class neighborhood. We are definitely a hot spot. Everybody wants to live and be around the Mission because we're so vibrant and we have so much a sense of community. But I do want to say that while many people have had to leave, a lot of us are still here, right? I was born and raised in San Francisco. I'm a product of San Francisco Public Schools. Like I said, my children actually attended the school that I get to be a principal of now. So I feel like our community and the community school within this specific neighborhood is a really phenomenal example of what it means to know that you are part of something larger than your individual self, and that you have a responsibility to the people that are in your community. So a little bit more about our school. It's a Spanish immersion school. What that means is that the majority of our day, all the way up through 8th grade, starting in kindergarten, all the way up through all the grades, is spent in Spanish. So students, for the most part, come from a home life where Spanish is the predominant language. And then if they don't, they're learning Spanish over the years. Everybody comes out fluent in both Spanish and English. We were the first Spanish immersion school in San Francisco. And so what that means is that a lot of Latino families seek us out because it feels like home. It feels like, they're not going to be stigmatized for speaking Spanish. We center Latino, Latinx culture at our school. And so it is a very, very much a homey environment. The way that this is juxtaposes with being a community school is the following. A community school, I promise you don't have to read all the text here, but I do think it's important to include the fact that we are a community school in my conversation about our project, because a community school means that we have an educational philosophy that every child can learn, even children that are experiencing very intense marginalization. But what we need to do is identify the barriers that are getting in the way of their learning, and then help them remove them, help their families remove them, wrap our arms around our community in all of the ways that they're experiencing difficulties, so that the student is free to settle into their classroom environment and learn. So for that to happen, first of all, we need to have really strong family partnership. And then another thing that we need to do is make sure that every member of our community has a say in the way that our school is run. So we believe in shared leadership. I'm not just sitting in my principal's office, like handing out missives all day. We are engaging with the community. We're asking what they need. We're asking what they want. And then we are trying to make it so. So that is the absolute culture of our school. And what we heard, students who were experiencing homelessness were more likely to have difficulty focusing in class. They were students that were more likely to have behavioral challenges. And so when we were having conversations with the family, as students went through their day and were experiencing these challenges, what kept coming up is, you know what, my child was up all night because we're sleeping in the living room of our cousin's house, or we're sleeping in the car, or we're sleeping in the laundromat, or we don't know where we're going to move to in a week when we get evicted. So this was something that was happening over and over again, to the point where we really realized that if we want to be true to our educational mission, we need to address the number one barrier that was coming up for our students and families, which was housing insecurity. You know, we have social workers at our school, and they do our very best to connect our students and families with resources and services in the community that can provide rent release, that can provide eviction defense, that can provide support securing more stable incomes. But it's not, you know, we have 600 students and it often feels like more than what we can hold. And so we started exploring ways to connect to other services in the community. And we did that by reaching out to our city supervisor and asking whether it would be possible for them to help us fund a program where our gym could be utilized as a safe space at night for our students and families who needed to stay in. And not only that, because we know that nobody wants to sleep in a gym, nor is it a permanent solution. But if, you know, worse comes to worse, if they need to, could that be an option? Could they be fed? Could we keep them safe? And in the meantime, could we offer them some wraparound services to make sure that they do end up with hopefully permanent supportive housing, if not temporary in the meantime. And so our city supervisor was very willing to pursue this. She basically said, I've been waiting for someone from the school district to come to us with this offer. From there, we launched this partnership, and we pulled in members of our school district as well. There was a lot of figuring things out because nothing like this had ever been attempted. As far as I know, in terms of a public school system offering use of its facilities at night to stage a shelter for students and their families experiencing homelessness and offering wraparound services. The mayor's office was willing to pilot the program, and we've experienced incredible success. It's no longer a pilot program, it's just part of what the City Hall funds every year. We're also able to now not just serve the students of Buena Vista Horace Mann, but we were able to expand it out to any student in the school district who's experiencing homelessness. They can come to receive the services that we have offered through our Stayover program. So that in a nutshell is what we've lived at Buena Vista Horace Mann as a community school in the last few years. This is just a picture of our school, and on the lower left, that's our gym. So if you see that there's like a garden area, that's the gym, and you would never know that there's a number of students and families staying there every night. Schools are where students and families spend the majority of their time, and the relationships that they have at those schools are the ones that families lean into when times are tough. They're the ones where, you know, it becomes evident if a student needs something, right? And so we have a very trusting foundation there, and we should use that to serve as a launch pad to wrap our arms around all of the needs that a student and family is experiencing. It's absolutely an educational imperative to do so.
questions that came up during the chat, and we have a couple. And this one goes to Arash. Is it a program that's available all through the states, or program only pertains to one state?
I think that you talk about the Safe Place program.
Mhm,
And if
yes.
you are talking about the Safe Place program, that is a program that we operate that is part of a national model that is called National Safe Place Network. Used to be the former Right Tech provider, but also the National Safe Place Network are basically just founded around the principle that we can use community and start with the fire department to really create safe places for young people that are in crisis situations, and use those existing community places to connect them to resources and organizations, and like a Nevada Partnership for Homeless Youth or others that can address their crisis. So for example, we partner with our bus system, fire departments, all of the libraries, and a local convenience store in town that's open 24 hours a day, 7 days a week, and has about 160 locations that basically give young people an entry point into our services on virtually every street corner, 24 hours a day, 7 days a week. And then we have Safe Place responders that will respond to those crises 24/7, holidays included, pick them up, try to get them into our shelter, other shelters, home, or whatever the most appropriate intervention would be for that in the middle of the night. But it really is a great alternative for them to get off the streets immediately when they're in a crisis situation, as opposed to having to go to the streets where bad things can happen quickly and exacerbate their circumstance. Thank you.
There's another question for Claudia. What other staff besides teachers and social workers are part of your staffing?
Because we're a district-wide program now, we needed to make sure that all of the social workers, all of the teachers and administrators across the school district were aware that they could directly refer students to the Stayover program. The Stayover program is actually managed by Dolores Street Community Services, which is its own shelter in the school, within the city of San Francisco, not related to the school district. So they're contracted to provide services, including those WRAP social work services that I described earlier. And then there's one coordinator from the school district who helps. They are the point person. If anyone has any questions about how to connect directly to the Stayover program, there is a person in that role at this point.
How might we collaborate with services that address compounding issues such as interpersonal violence, the foster system, to be innovative in our approaches?
I think the concept that I'd like to portray is that, again, kind of going beyond training, it's really partnering with those community-based organizations on each of those issues. You'll find that they're often intersectional too, right? So dealing with a particular sub-marginalization versus interpersonal violence versus homelessness, foster youth, sex trafficking, often these are the same youth, the exact same youth you're talking about, So I think it's about getting those different perspectives. And even I've been in a meeting where you've had several community-based organizations in a room and school personnel. And it's not just about educating everyone, but it's about, okay, what is the solution given, what's going on at this school, what our demographics look like, and what each of these organizations offer. That way we can actually provide holistic solutions, not a piecemeal approach, which is often frustrating to a young person and leads them to want to disconnect with services in the long run.
And I want to chime in also. So DIFRAC is a child welfare organization. However, because of our work and because what Arash just highlighted is that the challenges that families and youth are facing are often the same. And so just really highlighting the need to support the skill building for youth and their families so that they can make those important connections that can be life-saving for them.
Do you all have any resources, referrals for trustworthy grant writers? Some of you talked about funding and resources and connecting. So
one thing that I would highlight is don't be afraid to be intersectional in who you're approaching for resources. In other words, it doesn't have to be education or mental health or homelessness labeled in order for it to be accessible. Corporate partners are really great at trying really innovative things like hotlines or technology or et cetera. So sometimes you have to weave it together, but I'm not sure if you mean like resources on how to grant write better about the population or what, but that's how I took it, just to think about different intersectional lenses to stress in your grant writing and your development approach.
For our organization, we absolutely have the internal grant writers. However, we're continuously looking for different forms of funding that can support the needs of the clients. So for Hawaii specifically, we have like a public access site that allows us to monitor if there's any funding becoming available, or if there's any like RFPs that are becoming available for additional types of funding and such. And then there's also like the annual, we do like a huge fundraiser that brings in funders in that manner. So just a few different ideas and options.
You can look at it from either a mental health or a public health perspective. And so it's just deciding how you want to pursue that funding and support the work that you're doing to help guide you in the direction that you need to, that there are available resources, I should say.
How might therapists, peer specialists, social workers, and other providers adapt services, ensure cultural humility and responsiveness?
We do monthly all staff training, whether it be culturally based training or other supportive evidence-based training and such. In addition, we do partner with other individuals who can help to bring awareness to those matters. So that's what we do personally. And that's also part of our like strategic plan. Like our third goal for our 2-year strategic plan is to make sure that all of our staff participates in at least 100 hours of continuing education throughout the year, and just to allow them to feel confident in the skills that they are needing to have to do the jobs that we do. So those are just a few of our ways to approach that.
I think other things too is specifically around like understanding the cultural dynamics that youth are experiencing at home. I think that's really important for different cultures really manifest in different ways when it comes to school settings and behaviors and how those things intersect. And the more we're aware about those things, the more that we can respond in the classroom and through like school programming that can help augment those things. For example, one specific way around cultural humility is like just a referral to a hygiene room can still be not culturally sensitive. For example, like you need to really think about the right type of hygiene supplies and beauty supplies, or even cultural clothing, etc., that may make someone feel comfortable. So it's not just necessarily enough to have shampoo or this, or all referrals aren't equal in that sense unless we think about the cultural dynamics and angles, is what I would add. And to think about that everything you can.
I think it really matters how we talk about students and families and the challenges that they're experiencing, especially if you're talking about a student that's been referred because we know that they have a need. So we're very explicit with our staff that we need to always have a strengths-based approach where we really list, before we even talk about the needs, we really get an understanding of the family dynamic, what the parents are doing to hold it together, what the students are interested in, what they excel at, and really remember that we're not here to save anybody, right? We're here to serve them and help them out if we can, but also, they don't need our help in all things, we are not the answer, we're just a support. So the cultural humility piece is humongous.
The idea of bringing in peers or individuals that have lived experience, that is another thing that we do promote on our team. We have peer specialists as well as other peer support members that go and share their experiences and their knowledge and their understanding to also educate everyone on the team on cultural competency as well.
Thank you so much, Celerita, Arash, Dana, and Claudia. Thank you for guiding us today. Please join us for our session 4 in our series, Mental Health and Student Mental Health Workforce, the Woes and Wonders of Recruitment and Retention.